Good morning. Today we have Dr. Gunda and Alexsey. Gunda is the Chief of Party of Support TV project in Ukraine, and Alexsey is the Deputy Chief of Party. Dr. Gunda actually have a wide range of experience in tuberculosis, and she's a senior TB expert representing many WHO committees. I know Gunda, you are a pediatrician as well, and Alexsey is a digital health champion in Ukraine, Path Ukraine office, and he had a lot of experience in introducing digital tools into program management. Gunda and Alexsey, I would want to know that Ukraine is a program, TB control program, which has been focusing on decentralizing and offering services at the primary healthcare center, right? And you have gone through that journey. So could you please explain what was the role of digital tools in that? And or even if that is not introduced right now, how do you envision digital tools can probably enhance the service delivery at the primary healthcare level?
Yeah, thanks Shibu. Thanks for invitation. So first of all, what we did to decentralize access to care is a procurement of new portative X-rays, digital X-rays, as well as upgrade of existing mobile X-rays. It's not just repairing the car, but it's also upgrading the X-ray technologies. So basically all machines which we supported repair, they are digitalized and they have a capacity to use artificial intelligence.
Perfect.
So this is the basis, and we can build on that. And Alexsey can say more about digital adherence technologies, which we are also supporting, which are also very important to enable outpatient care. So maybe Alexsey?
Alexsey, what is your experience? Good to know that it's all digitized right now. Do you have any thoughts on implementing AI as a support tool to interpretation of X-rays?
Yeah, that's the idea, because as you know, because of shortage of staff and also because of war, of course, we have a gap in access to radiologists, and also not always they can join those visits to districts, to regions. They cannot be at the place and they cannot describe the X-ray pictures in real time.
Correct.
And that can cause delay in diagnosis, because potential patients, they can get lost. They will not wait for X-ray description, and we potentially can lose them. So that's why we see the role of artificial intelligence in real-time interpretation at the site, and then we can immediately identify patients who need additional examinations. That would be a perfect picture.
Yeah, very true. Very true. So switching from diagnosis to treatment adherence, you mentioned about, Alexsey, you were part of the Accent TB project wherein a lot of digital tools were tested. So what is your experience, and from the lens of a decentralized care, how does all these digital tools is going to help the patient journey?
Thanks. I guess digital tools simplifies all the case management, because people can move from one facility to another, they travel a lot, and digital tools allow us to follow all these patients that can be easily went from one specialist to another one, keeping in touch still with those who are responsible for a particular disease as well. But also, in addition to decentralization, I would add that Ukraine is also implementing a health system, and we are switching to fully digitalized medical records to MRS, where all X-ray images, etc., will be with time also kept. And in addition to AI for screening, I would say that specialized clinics equipped with AI could also help to triage other diseases as well, because AI is able to put on spot some other signs that could be easily captured and speed up the process, not to lose the patients.
Yeah. So just again, so I appreciate your efforts during the conflict time that you guys have actually bumped up your services, and also very encouragingly, we are witnessing your TB control efforts. Your TB case finding is still stabilized and going up, and then your care service delivery and the care offering is not being disturbed that much. Huge appreciations for that. And just coming back to, so now we are focusing on primary healthcare centers and as a TB service delivery. And most of the solutions now, AI solutions, be it AI or digital solutions, are now being disease agnostic. So even for that matter, Qure.ai, we have a solution for detecting musculoskeletal injuries. So that probably fits well into your conflict situation wherein there are no doctors. How do you identify fractures? Do you see such kind of a combined, joint, integrated service delivery being planned?
Yeah, definitely, because of course the name of the project is Support TB Control Efforts in Ukraine, and our primary focus was early detection of tuberculosis. But as all the services are switching to mainly to primary healthcare, they cannot go just disease by disease. They have to treat patient in general. They have to ensure complex, comprehensive care for each patient. And if there is a reason, indication for doing X-ray, musculoskeletal X-ray, or trying to detect another lung disease, so of course they have to look to the patient as with all his problems. It cannot be just focusing on one disease. Absolutely.
Perfect. So, so our solution is actually right. I think when we position solutions or design solutions at our end, we also keep this thing in mind. So we kind of de-silo from and as a takeaway, we keep the focus away from single disease to a multiple disease focus. So we do have capabilities of detecting tuberculosis. One is the X-ray reporting capability, which is agnostic of disease. So this is what we are seeing in X-ray. AI will say, which is pretty much similar to as a doctor. And then it also notifies early lung nodule, which is a lung cancer detection, which helps in lung cancer detection. COPD findings will be coming in. There will be findings of cardiothoracic shadow increase, and then probably heart failure will be notified. So it's a perfect fit. So just out of interest, again coming back to the pediatric, because you are a pediatrician, you are also representing WHO Pediatric Committee, if I am not wrong. So it's a key challenge globally. And how is it there in Ukraine? Are you seeing more number of pediatric cases identified?
Number of
pediatric TB cases?
It's how much?
It's around 500 cases per year.
Okay.
It could be less or more.
Okay.
Currently the numbers are growing slightly, but also we have to consider that lots of people currently leave the country, but still the number is still, so it means that the rate is we are growing.
Okay.
Yeah, for pediatric cases, definitely pediatric adolescent cases, I think for adolescents, definitely we can use the same artificial intelligence. For young children, I would say that on top of simple X-ray screening, just using chest X-ray, we need access to CT scanning, which is I would say insufficient yet, and I'm not sure. I don't know all the technologies, but I'm not sure if it can be solved by artificial intelligence. I mean CT scanning, but definitely for adolescents, the same technology could be used. For children, young children, we need CT scanning too.
Okay, that's a fair point. So, in fact, Myanmar team has actually utilized the Qure solution for screening children as well. So 4 years and above, and they see encouraging results out of it. I know that it's not being recommended by WHO. The recommendation is 15 years and above by WHO. But this year, World TB report calls out the requirement for an artificial intelligence tool for below 15 years as well. So it's a fair point. And we are also enriching our algorithm to accommodate more for the pediatric TB cases. So coming back to that you're reaching TB burden, TB screening efforts. I know in the previous USSR countries, it was a practice of population level screening, annual chest X-ray screening. Is that being practiced there now in Ukraine?
There is no mass screening, and my personal opinion, we don't need that because it didn't give us sufficient yield.
Okay.
However, as we are going to away from screening just for single disease, as we just discussed, it's very important to have regular chest X-ray screenings to diagnose in early stages oncological diseases, other diseases. That's very, very important. And to your point about children, children are always sort of in a second row, because treatment, first of all, is for adults, because clinical trials are designed like that. Then also X-ray screening, it's more designed for adult screening. So I fully agree that we should gradually go down in age groups and to enable and to promote the same approach also for children, and collect data and provide evidence and contribute to WHO guidelines.
Perfect. So I know that Ukraine still have a high burden of MDR TB, and also you're trying. It's not an X-ray question. This is just generally understand that what are the new innovations you are trying out for MDR TB treatment, follow-up, new diagnosis.
Yeah, Ukraine, I think, is one of the most active countries, despite challenging conditions, COVID and war, etc. Ukraine has introduced all recommended new regimens and is part of operational research and modified shorter regimen, the 9 months regimen, which is adjusted for a situation in WHO region. Ukraine is one of the pioneers introducing BPALM regimens countrywide. So I think Ukraine is on top of that. And also what, thanks to our project, thanks to USA, the funded project, we are doing is introduction also of preventive treatment. And there, also for XDR-TB, for XDR, drug-resistant TB, not XDR-TB. And this is where the role of X-ray screening is also important, because first of all, we have to exclude active TB disease, and then we can discuss and think about preventive treatment. So first of all, exclude active disease, X-ray, and then do prevention.
Perfect. So it sounds like, okay, all the innovations which has been recommended by WHO has been already implemented, or you are also
not on
advanced.
full scale, but yes,
that's on some level of this thing.
Yeah.
And also you are now introducing preventive treatment for MDR-TB. It's
Yeah.
wonderful to hear that. Alexsey, like switching to you, you mentioned about the digital transformation happening in the country now, and alongside the decentralization of care. What are the processes the country laid on for that? So typically a country will have an assessment done, a roadmap made, and then the budget will be allocated, then partners or donors or country will invest in that, then implement it. So what is your experience in Ukraine? How was this designed, the digital transformation? I'm not talking only about TB, but general transformation. How does TB fits in that transformation?
Thanks, nice question. And in general, I would say that Ukraine has a strategy for implementation of e-health. We have even a special ministry for digital transformation that overall capture all the different things around the country. It's not only health. In terms of health, in particular, Ukraine is introduced to the central level of e-health, a centralized database that is also dictating the rules for all medical information system for data exchange and data latency as well. So we are going in this direction, and it means that we in future will be able to capture all this data. So whenever you come to the clinic, the doctor, based on the permissions, I hope, from the patients, will be able to get access to the relevant data, and it also includes. Has to include X-ray data, and within our project we also supported integration, and in some clinics it's already implemented. So once X-ray done and diagnosis prescribed, all these prescriptions are available for all the doctors in the clinic.
So there's an overall actually strategy, and then actions as have been taken. You also kept patient in mind, and if they would want that information, you can share that. So that's a well thought out, well laid on, I think, strategy and plan, and which has been implemented. Thank you so much for actually taking time and chatting with us, and also huge appreciations for providing uninterrupted service to the patient in light of the war happening there. I hope that the situation will settle soon, and we are all praying for that. Thank you so much for coming down and chatting with us.
Thanks, Shibu.
Thanks.